on 3 millionth female through England include not had a smudge testing for at low 3.5 year. GPS are hard to enhance get-up rates as figures show up to part of female by 50 in several areas include not had a neck screen in the suggested period box. Screen rates are at their minimum for too many decades. Social Public Health England told it was worried by the drop. A future millionth female elderly 50 to 64 include not had a smudge testing for at low 5.25 year. On 72% of female elderly 25 to 64 include had a smudge testing during the time suggested for their year, on to figures drawn up in March 2017. The is downward of 75.4% in 2012. A full of 220,000 UK female are undiagnosed in neck abnormalities every year and down there were 854 deaths of neck carcinoma England 2016. Neck screen detects anomalous cells on the entry to the uterus. Sam Alena, of Kingston, says the way of a nursing at a neck screen she had elderly 25 was this contrary of encouraging. It was 10 year up she had else one and the outcome led to a diagnostic of neck carcinoma. She had to expose a pair of operative and has later been taking into account the all precise. I treated across the sea and routinely excited, so I ever seemed to escape thought on he, she told. I never had any symptoms for neck carcinoma, and so didn't sense I necessary to go to the physician. The extended for a 10 years before a nursing at a usual public health verify in 2010 said her she was expired a screen. Industry advisor Ms. Alena told the testing should be seen in a such way to departure to the dental surgeon or opticians. Affirmative, he's inconvenient and no he's not a enjoyable expertise, but my history shows how essential it very is, she told. London has several of the minimum rates of female shielded for neck carcinoma. In several boroughs fare above part of acceptable female by 50 had a testing during the history 3.25 year. Cambridge and Oxford as well had rates of 54 and 55%. In Leicester it was 60%, growing to 61% in Luton and 62% in Manchester, Swamp, Haringey and Birmingham. Rushcliffe in Nottinghamshire was at the sum late, in 80% of acceptable female possessing had the testing in the history 3.5 year. A representative for Rushcliffe CCG told practices in the Nottinghamshire region recognized not to be reaching screen targets were taking into account additional supporting. She told Carcinoma Study UK had been helped to enhance understanding. A examination of 2017 female by the Mercy Joe's neck carcinoma confidence offered youthful female were confused to visit smudge tests since of their flesh form, 35%, the exterior of their vulvar, 34%, and concerns above odor, 38%. A tertiary told they would not go if they had not waxed or shaved their string bikini region. On 15% told they would miss their smudge tests for a gym grade or a wax assignment. Dr. Laura Marlowe of College School London carried out study in neck carcinoma screenings and told ethnic origin as well play an essential part. We found how female of ethnical minority groups were more than potential to be ignorant of screen and older female were more than potential to include solved not to come, she told. Insight these patterns will assist us to solve how interventions might be profiled otherwise for various types of non-attenders. Yet, she added, I believe we include to be cautious on proverb how ethnic origin contributes to the total numbers since it is just a portion of the image. A representative for clinic input groups, CCGs, in polar western London told GPS florid challenges in areas in tongue impeding, sectarian concerns and top levels of privation. Dr. P. H. Kaslewal, CEO of the Department of Sex and Reproduction Health, told, neck screen is not a authorized demand for regional credibility input. Regional authorities by harsh budget blood pressure are not consisting the significant dimension of females' public health thoroughness in their facility technical specification. GPS include a really favorable part to act in growing understanding by offer opportunist screen, but initial thoroughness is not capable to efficaciously encounter the enlarged consumer demand. Screen rates are now at their minimum in too many decades, and the minimal 80% domestic goal is far of creature reached, she told. Dr. Kasliwal is inviting for asset and more than financing for next screen in initial health, and for it to be turned on in sex public health services. Female in Polar West London. Female are creature proposed night and weekend screenings in procedure to do it more than easy to visit. Robert piece of music of Joe's carcinoma confidence told down there was no one sorcery decision to enhance maintenance, but the mercy was work in GPS to ensure fall in surgeries, telephone clinics and betrothal in society or belief groups. Professor Anne Mackey, FEE's CEO of Screen told FEE, near charities consisting Joe's neck carcinoma confidence, the NHS and regional authorities are worried on the drop in female take the testing. Now 72% of female include neck screen, and we're work along to provide how each female knows which the testing is on and to do it lightweight to visit screen serving.